Thank you, Amali. I am Rajendra Gupta. I chair the Dynamic Coalition on Digital Health, and I also chair the Commonwealth AI Consortium for Capacity Building across Commonwealth. Um, First thing I would like to say to demonstrate the difference between robot and human being is, as you can see me, I'm like almost sleepy. I woke up at 2 a.m. Robots don't do that, so and this is what a few years back when I was in the same country, I saw a robot and I asked them that why would you need robots in a hospital? He said they don't chat when they go in the aisle, so they can just work. And we don't ask for wage increment. But jokes apart, last month we hosted the Global Digital Health Summit in Mumbai. If you look up globalsummit.health, and what we demonstrated was very interesting. Like we have a panel here. One of the panelists was a robot, and this was indicative of the things to come in future. I mean, you can look up that video. The robot answers the questions that he was thrown, and the questions were thrown by the global strategy head of Google, Bakul Patel. So I think robots are for real, and they will invade medical field for various reasons. And last couple of weeks, I've been working with one of the architects of Da Vinci, trying to make the future leaders aware of what robotics can do. So there are two major roles that I see for robots in healthcare. One is they will replace routine tasks. Routine tasks is like carrying blood samples, taking medicines, transporting patients, and routine stuff. I mean, this is just like you don't require a human intervention. And the second is most important, which is medicine. So let's accept that robotic capability exceeds human capability. That's the first fundamental truth. So that is where, when you look at routine, what it'll do is cost savings and probably bring in some efficiencies on the floor. But where the medicine part comes in is very interesting. And this I have been having discussions because of not only the summit but also the course we run on digital health. We've been talking to actual leaders who actually were involved in robotics and the development of robotics as a field. So I think the biggest thing would happen is that surgeries would be precise, and that is what I have spoken with a hospital that implemented robot. I said, why did you implement? What's the outcome? He said, clinical outcomes, less blood loss, patients are happy, better healing. So there is a proven benefit of robots on the clinical side, and on the when you look at the functionalities they can take on to. So like you have a physiotherapist today, a robot can do that better. A robot can be an exoskeleton for a person who has met with an accident and needs the artificial limbs. Transplants, today they are doing almost all the surgeries. I think one of the biggest things that you will see, and I think aging nation like Japan is a very good example, and I think all nations will eventually reach that stage, is the social interactions, doing that for seniors. And other than that, like in COVID, we saw, some of the hospitals started using for interaction with patients to avoid the spread of the infection, including, the sanitizing of the rooms, serving the patients. So robots are getting there. My worry is that this is not democratization of robotics. It's very high end. So a robot that I spoke to in a hospital, like, they had implemented, was $2.5 million. So expecting that robots will be like used like everywhere in every hospital, that's not going to happen very soon. Yes, we are far away. Have they been able to demonstrate their ability? Of course, yes. They can do much better job than doctors in precision operations. In invasive surgeries, they can do what a hand can't do, what a doctor's eye can't do. So this is clearly there. But what I envision in future, and this is what I have been talking with the man who was behind the architect of Da Vinci, is that eventually I would see robots like a cardiology robot, urology robot, gastroenterology robot. So I see a specialization of robotics happening over future, and I think we will hear, I think in next few months, another company launching a miniaturized version of robot. Da Vinci is like a huge setup. When that happens, I probably feel that cost may come down a bit, but will it be democratized? Absolutely not. So, well, as a part of medicine, most of the high-end hospitals, maybe in specialized, departments, or maybe big hospitals, private hospitals, they may use robotics, but will public facilities use it? Very clear no. I mean, they will still prefer surgeons. who would do a job at a much cheaper rate, because the initial investment is very high, the cost of maintenance is high, and if the technology changes, what do you do? So it is still to go a long way. But there was another question, I think, that we were talking about the remote surgery. So there is ample of evidence to show that uh, hundreds of miles away, you can actually mimic a surgeon's movement and do a surgery. I was in Poland early this year and actually tried my hand from that robot. Actually, for me, it was not easy because I'm not a surgeon. I tried to, but it's like if you train people, you can end up doing remote surgeries. But it will mean like we are still years away unless the cost comes down and we have enough trainers to train doctors. But as a field, I think it's developing pretty fast. So I see a future when there will be specialized robots, but we're still on the clinical side, we are far off. But on the routine side, I think we will have a faster adoption. So between clinical and routine will take off fast. Clinical is still years away. Thank you.